Now it's mostly Nahau members that are continuing protest action. Patients were severely inconvenienced at some hospitals, with workers leaving their posts and taking to the streets. Nqobile Madlala is in Pietermaritzburg and tracking events for us. She joins us yet again with the very latest. Good morning again, Nqobile. We see now you have a number of protesters behind you, but earlier we were seeing heavy police presence. So somewhat of a stabilized and orderly situation today. Talk to us about what we're seeing at the back.
Well, yes, Mfundo. So from that time when we saw quite a lot of heavy security when we were at Grace Hospital, now we see members of Nahau. They are getting ready, of course, to march. They are in certain sections, so just as many behind them and just as many in the front of us. We do know that they are now going to be marching to the city center. And perhaps, Ayanda, just enlighten us, where exactly are you marching to now?
Thank you very much. Today, the MEC for Treasurer in the province is delivering the budget speech. So you remember that as Nahau, we are currently on strike, and we have been very, very clear on this point to say Treasurer is one. The National Treasurer is the one that is responsible for ensuring that we don't get our salary increases. So we'll be protesting outside the provincial legislature, raising the question that have led us to the strike. We remember that the national union across the public service is still on strike, demanding 10% salary increase, demanding 2,500. And we're also making a point across the national treasury, the provincial treasury, to say they must get rid of the austerity measures. There are many vacancies in the public service that are not filled. We want them to be filled so that our members do not do the task of 3 or 4 people who are supposed to be employed in the public service.
I mean, we know that you had said that there were some meetings that you were going to go into and negotiations. How has that been ongoing at the moment?
We are going to report to our members. There are some slightly discussions that we are going to report, but there's nothing that is concrete yet, because there are some loose ends that they need to be tightened up. So the meetings, even today, they are going to proceed. So for now, we don't have anything tangible that we think that we can report to our members.
And we saw some of these hospitals having some heavy security, and we saw some of the people going into hospitals today. So from your end and from your workers, is there more people working today?
Yeah. As Nahau, we have never been against that the patients must receive the access in healthcare. We are never against that. So that is why there have been propaganda that have been spread across to say Nahau does not want patients to access healthcare. Healthcare is a right to the patients. Therefore, we have never been against that. So it's like also even chasing ambulances, we have not done so. So if the patients are entering the hospitals, we have never been against that.
I mean, we're hearing 4 people have passed away, and I mean, it could potentially be because of the strike. What's your take on that?
No, that's just a propaganda by the Minister of Health. We don't even want to respond to him, because it's not worthy of any response.
So what happens today then?
No, we continue with the strike. We are going to hand over the memorandum to the MEC for Treasurer, and we do hope that we will tell her that in 7 days our memorandum should have been responded to.
But does he know that you are coming?
Yeah, she knows. She's ready for us.
All right. Thank you very much for speaking to us. Well, that is the protest starting, march also starting, going to the legislature, where they are going to be delivering that memorandum. These are some of the workers, of course, still aggrieved by the fact that they want the 10%, saying that life has changed, it's more expensive now, and as a result, they need that 10%, and they need a lot more, asking for government to listen to them, as they are those essential workers that do need that financial assistance in this time.
Thank you very much for that update. That's reporter Nqobile Madlala.